We welcome you back to News 5 at 6. I'm Courtney Gooseman, still here live, continuing coverage at St. Vincent Charity Hospital, where in a few months, inpatient and emergency services will end. And with that, the landscape of Northeast Ohio healthcare will see a significant change yet again. News 5 investigator Jonathan Walsh breaks down past hospital shutdowns and the impact it's had on patients.
To understand the context of the St. Vincent announcement, let's take a look at the bigger picture of what's been happening in the Cleveland area. Fewer and fewer community hospitals have been available recently, whether it be from closings or consolidations, and that affects us all. Back in 2000, there were 42 hospitals in Northeast Ohio. That's according to the Cleveland Hospital Association. Those hospitals had 30 different owners. But over the years, the hospital landscape shifted. An ownership arms race between Cleveland Clinic and university hospitals.
We were a teaching hospital.
Dr. Robert Haney worked at Mount Sinai Hospital for 22 years. The hospital was sold and then closed in 2000.
I came to the hospital and there was all the news channels and we were told we got 2 weeks.
By 2020, 5 other hospitals had closed, like St. Luke's and Huron Hospital. Other community hospitals bearing names of suburbs, Parma, Lakewood, and Euclid, taken over and repurposed. Despite all of that, Dr. Haney says he doesn't think patients are worse off today.
I don't think we've had a drop off in quality. In fact, I don't think you can get better health care anywhere in the world than in Cleveland.
This is something I've been looking at for a long time.
Dr. Martin Gaynor from Carnegie Mellon University has studied hospital consolidations for 40 years.
Prices are high and rising. There are egregious pricing practices.
Even testified in front of Congress.
This massive consolidation in healthcare has not delivered for Americans. It has not given us better care or enhanced efficiency.
He tells us in the past 20 years, there have been 1,600 plus hospital consolidations around the country. He disagrees with Dr. Haney about the caliber of care.
When there are mergers that between close competitors, the quality actually deteriorates.
Dr. Haney does tell us there are still unacceptable infant mortality and longevity rates right here in Cleveland.
In fact, in Fairfax, where I do a lot of community outreach, it's much more like a second or third world country.
Today, Cleveland Clinic, UH, and Summa own 66% of the hospitals that were listed in 2000. Dr. Gaynor reports consolidations in general bring lack of competition, lack of options for patients, lack of appointment times available.
People really are worried about our healthcare system and they're unhappy about it.
I'm News 5 investigator Jonathan Walsh.
So St. Vincent isn't the only hospital to make changes to its operation in recent months. Last month, we told you that university hospitals ended surgical, inpatient, and emergency services at its Richmond Heights and Bedford campuses, citing staffing shortages. Now, both locations still offer physician, ambulatory, and well-being services. Now, we've been hearing the term healthcare desert lately, so we wondered, where does Cuyahoga County stand? GoodRx took a look at access to different kinds of care, and while nobody in the county lives in a hospital, trauma center, or pharmacy desert, 7% of Cuyahoga County is considered a primary care provider desert, with more than 5,500 people for every one provider. It's also a low-cost health center desert, with 12% of people living 20 or more minutes from the closest federally funded community health center. Rob, we're going to continue to dig into the impact that these changes are having on our communities at large. And of course, for the latest, you can always check our website. That's news5cleveland.com, as well as check us out tonight on News 5 11. Back to you, Rob.
We are committed to that. Courtney, thank you so much.